Good day everyone. I'm Alessandra Simbabanag from BPA 2020. I am here today to tackle about substantive policy issues, healthcare policy. Before we proceed to our main topic, which is healthcare policy, first, let's define substantive policy issues. What is substantive policy issues? Substantive policy issues, empowering low-wealth grassroots societies, requires building the capacity to impact the formations and implementations of public policies to address the needs and interests of society. It is the policies which take into account the general welfare and development of the society. It deals with the society as a whole and not with any particular or privileged segments of it. It is economic stabilization, education, and employment opportunities to all irrespective of caste, measures of safety, populations, law and order informations in a given political system. Let's proceed to our main topic. So what is healthcare policy? Healthcare policy, it refers to the decisions, goals, and actions that determine how care is administered and accessed. Healthcare policy, it is the policies that set on a national level in terms of access to healthcare, coverage, and cost. For example, policies can include legal and safety regulations by state or protocols regarding how care and medicine are delivered to patients at a specific hospital. The following are types of healthcare policy. The first one is public health. Public health describes the policies enacted on a national, state, or community level to promote healthy lifestyles and prevent the spread of infectious diseases. When we think about the word health, we typically associate it with medical matters. Public health is not a one-on-one discipline, nor to those in the field practice medicine. Instead, public health focuses on improving and protecting community health and well-being, with an emphasis on preventions among large groups of people. Those with public health degrees keep communities healthy through child wellness, disease preventions, educations, disaster relief, access to healthcare, and much more. Second one is pharmaceuticals. Pharmaceuticals may touch on the regulations, availability, and affordability of pharmaceutical products. Pharmaceutical policy is the part of healthcare policy that aims at addressing these problems and increasing access to safe, effective, and affordable medicines for all patients. Third one is mental health. Mental health is a key consideration in creating health policy, providing goals and objectives for promoting mental well-being and treating those with mental health conditions. Our mental health impacts our physical health and overall well-being. Someone struggling with mental health, such as anxiety, depressions, an eating disorder, or addictions, can find it difficult to maintain focus. Find motivations for tasks and relate to peers and colleagues. The effects of mental health on our mood and ability to function throughout the day can impact all aspects of our lives. Fourth one is health insurance. Health insurance may also determine the role that insurance plays in financing care, promote affordable or public corporations, and regulate what insurers can and can't do. Health insurance, it is a contract that requires an insurer to pay some or all of a person's healthcare costs in exchange for a premium. Specifically, health insurance pays for medical, surgical, prescriptions drug, and sometimes dental expenses incurred by the insured. It can reimburse the insured for expenses from illness or injury, or pay the care provider directly. Fifth one is healthcare services. Healthcare services, it refers and services included in the furnishing to an individual. Healthcare provided by any individual working under the supervisions of a healthcare professional that relate to the diagnosis, preventions, or treatment of any human disease. Let's proceed on the importance of healthcare policy. Healthcare policy is important because it helps establish guidelines that benefit patients, healthcare organizations, and our healthcare system. When we say the importance of healthcare policy, it, it is when the patients take time to understand healthcare policy. They learn more about their rights, and having protocols in place can help prevent human error and poor communications around medical decisions. For nurses and health administrators, it is understanding and following policies can help ensure that you deliver the best care to patients while using your knowledge to help inform future policies. To be able to maintain quality care for patients, organizations must set policies to address the following aspects of their operations. The following are some examples of healthcare policies. Patient care policies. Patient care policies cover protocols and workflow for treatment procedures, outlining how healthcare professionals should respond to specific medical situations. Of course, policies must be tailored to the care of your facility provides. For example, a cancer center would create different patient care policies than would a center for rehabilitative medicine because their treatments protocols are so different. Employee health policies. The health of employees is a crucial component of running an effective facility. A staff must be able to care for patients safely while maintaining their own well-being. Employee health policies, it is the policies designed to protect and promote employee health, includes rules around the consumptions of alcohol and tobacco in the workplace, wearing masks and gloves to minimize the risk of exposure to illness and chemicals, and wellness policies such as time off and healthy eating. Drug policies. Drug policies outline procedures around the handling and administering of pharmaceuticals, whether the medication is over-the-counter, controlled, or non-controlled. Drug policies cover what to do if inventory is missing, if medication was incorrectly administered or prescribed, if any other errors occur related to drug handling. It can conclude protocols for recording and delivering each medications. Security policies. Security policies clearly outline how employees should handle situations that pose a security threat in their facility. Security policies is extremely important in any healthcare facility. It is to protect patients' information from release to the public. If a facility has security processes, this must be clearly outlined for all employees to know and follow. It can include situations like abuse towards medical staff, patients' abductions, or active shooters. The Philippines face a lot more basic issues that prevent healthcare professionals from giving the best care that they can. Here are some healthcare policy issues. First, majority of Filipino people lack access to basic health care. In the Philippines, access to basic healthcare services remains a major issue. Poverty has prevented millions of Filipinos from getting the healthcare services they need. Even before the pandemic started, 16% of Filipinos live under the poverty line as per Asian Development Bank. A lot of Filipinos are too poor to go to the hospital and get the treatment they actually need. And it's unable to afford this basic health care. It has negative impacts that includes increasing the higher mortality and lower life expectancy. Second, social barriers. Social barriers, it is related to the socioeconomic conditions in communities. It can help improve the overall health of individuals in these populations. Social barriers, it is some public health clinics and nonprofits are working to provide wellness, counseling, and other services to people beyond just medical needs. It includes access to healthy food, affordable housing, transportation, childcare services, and educations. A healthy population leads to better outcomes and more affordable care for all. Third, provincial hospitals have limited access to medical supplies. It can be challenging for hospitals in rural areas to acquire all the medical equipment and supplies they need to give patients the best care. Provincial hospitals operate with a limited budget and it is important for them to acquire excellent quality products rather for patients. Also, it can be difficult for them to have products shipped to their facilities. And lastly, healthcare costs. Healthcare costs, even with health insurance, many individuals still face overwhelmingly high out-of-pocket healthcare costs. In the wake of the COVID-19 pandemic, it has become even more imperative for lawmakers to find an affordable solutions for fellow Filipinos. Policymakers have discussed finding a way to lower prices without compromising the quality of the services and care provided. Some solutions include reducing prescription drug prices or allowing policymakers to regulate healthcare prices. The public options would make health insurance more accessible to those who can afford the premiums of private health insurance. Let's proceed on the role of healthcare policy analysts. Healthcare policy analysts play a great role in making effective changes to our healthcare system. They are responsible for evaluating current policies and suggesting improvements that can impact patient care. When we say the role of healthcare policy analysts, it is the day-to-day task to meet with lawmakers, raising public awareness about healthcare policies, and it is reporting and presenting their findings. And also, it uses critical thinking skills to compile and evaluate relevant data and research. It suggests changes to current policies and create new policy proposals. That's all for today. Thank you.